So my first question is for the common people, like what is the MitraClip procedure and how does it specifically help patients suffering for mitral regurgitation? Yes, sir.
So the MitraClip procedure is a transcatheter, minimally invasive procedure which is done through the groin without stopping the heart, where we can actually repair the leaking mitral valve by applying a small clip to the leaflets. This technology was based on a surgical principle and then was adapted into a catheter procedure. The company that makes it is Abbott, and the device that is available in India and all around the world is called the MitraClip Generation 4. There are two fundamental types of leaking valves. One is primary leakage, means the problem is the leaflets. And when it leaks, the treatment of choice is either repairing the valve or replacing the valve. And whenever possible, we like to repair a valve so that we can keep the patient's native valve behind. The second group is patients where they have a weak ventricle, and because of the weak ventricle, the leaflets are pulled apart and they leak. And this group of patients are not great candidates for surgery, and the MitraClip is a very suitable candidate for this group of patients. So we have two groups of patients. One group of patients who have very low functioning ventricle, low ejection fraction, and leaking valves, where it saves lives and improves symptoms and reduces admissions for heart failure. The other group is where you have a primary leaking valve due to a prolapse. It also works very well, and it helps patients' symptoms and is ideally used for high surgical risk patients. In India, I have a feeling that the role for this form of therapy is going to be amazing. And the reason for that is that a lot of patients in their late 50s or 60s suffer from this disease, and they're often higher surgical risk patients. And this treatment option allows us to safely treat these patients because the safety of this procedure is very, very high. And in fact, it is much safer than a surgical procedure. So I personally think that this technology and this therapy will continue to rise and will help a lot of patients to make them feel better and live longer.
Thank you very much, sir. And you have talked little bit about this, but like who makes an ideal candidate for this MitraClip, and what factors do you consider when determining eligibility for this treatment?
So obvious, as your question has clearly mentioned, the MitraClip procedure is not meant for all leaking valves. There are certain anatomical criteria which makes them suitable, and there are certain anatomical criteria which makes them unsuitable. So the suitable group is patients who do not have rheumatic heart disease, who have a valve size which is adequate, which is usually 4 square centimeters. The leaflets are not calcified, and they could be either prolapse or restricted. And if they have a reasonable size orifice, they're a good candidate. The candidates which should not be used is patients with rheumatic heart disease, with patients with combined mitral regurgitation and mitral stenosis, or in patients where the leaflets are calcified.
Sure, sir. Thank you. And in what way does the recovery process after the MitraClip?
In the regular bed, and most patients go home by the next morning. If the patients are very sick to start with, they may take a few more days to recover. But in a nutshell, the recovery is significantly lower than surgery. I mean, the time days, it's usually 1 to 2 days. Surgery is 5 to 6 days. There's a higher chance of infection, higher chance of bleeding with surgery. All of these are much, much less with the MitraClip procedure. So it's definitely a safer procedure, and therefore for high surgical risk patients or older patients, this should be a preferred option if their anatomy is suitable.
Great, sir. And how does undergoing the MitraClip procedure improve the quality of life for patients?
This is a very good question. How does it improve? So what it does is when you reduce the leakage of the valve, two things happen. One is more blood goes towards the aorta into systemic circulation, so the patients have less fatigue and more energy. Also, because the valve is not leaking, there's less blood going to the left atrium, there's less pulmonary congestion, there's less shortness of breath. So the two improvements are reduced increase in activity and energy level, and reduced shortness of breath and heart failure.
Fantastic. And what are the potential risks and complications associated with MitraClip, and how do you manage these to ensure patient safety?
So the MitraClip, even though it's a very safe procedure, but a small percentage of patients can undergo some complications. So one of them could be a hole in the heart. Like when you're doing the transeptal puncture, there can be a small bleeding around the heart. It occurs in less than 1% of patients, and usually you can treat these patients by just percutaneously draining the blood. The second complication rare is partial clip detachment. That means you attach the clip to two leaflets. About 2 to 3% of patients, it can come off one of the leaflets. And when it comes off one of the leaflets, there's no acute crashing of the patient, but the patient becomes symptomatic again and the leakage recurs. And the treatment of choice usually is trying to put another clip in. Or if you can't, then the patient has to have surgery. But it's very rare for a patient with a MitraClip or a failed MitraClip procedure to undergo an acute cardiac surgery.
Got it, sir. Thank you. And the last question. What further development do you foresee for the MitraClip and similar technologies in treating heart valve condition?
So the MitraClip procedure is a standard transcatheter repair option for multiple patients. The current generation is generation 4. There's a new generation coming up called generation 5, which potentially will be available in the next year. And what it will do is, the goal is, I don't think it will reduce the leakage anymore, but it will make the procedure slightly more safer, and also in difficult anatomies it might be easier to do. So that will be the goal. In addition to MitraClip or the procedures similar to MitraClip, there are other transcatheter procedures which are being developed, repair as well as transcatheter replacement of the valve. Not just repairing it, but also replacing the valve.
Thank you very much for your time,
Yeah.
and it was fantastic, sir,
Yeah.
to know of new advancement in this technology.
Yeah.
Thank you.
I just want to add one line
Yes.
that all the clinical trials and the cumulative data has shown that the MitraClip adds years to life and life to years.
Great, fantastic.